Hello. Hi, everybody. So people might be tuning in here. It's Dr. Scheiner here again, and today what we're going to do is we're going to be showing you a lip augmentation or lip injection that we're doing here in the office. And we have a wonderful patient who is volunteering to allow people to see this. And so I'm going to turn this over in a moment to my assistant, and she is going to help to film this, and then I can ask, oh, thanks for the love there, Travis M. Eckert and Mary Jane. So she's going to help to film it while we're doing the treatment. So I think you'll find this kind of interesting, okay? So I'm going to flip this camera. There we go. Sally, thank you.
Yay.
Okay. And we have Jess here, who's our wonderful patient, and she she's cute as she is, but we're going to make her a better version of herself, right?
Yes.
Okay.
Aloha from Hawaii.
Oh, aloha. Mahalo. Okay, so what we're doing is she's already, when I do lip augmentation, I really want to make sure people are comfortable. So some people will just use ice, and yes, these are the funny glasses I know that I had yesterday. This is so that I can see things better. A lot of people will just use ice and topical anesthesia, and we have patients who come to us saying we never have lips done again because it hurts so much when they do that. And so thankfully, when I'm doing this, we actually do anesthesia, right? We did anesthesia on you. So her lips are numb. I do it inside the mouth. That makes it a lot easier. And so we're about to do this. So she's numb and comfortable. And she has really pretty lips. And the thing that I want to do is I want to create a little border around her lips. And her lower lip is really pretty. The upper lip is a little smaller, and I want to bring them more in balance. For me, it's all about balance. You have questions?
They have questions, yeah.
Yes, questions.
First one, somebody recognized you from Kaibela, so they say hi from Kaibela.
Oh, hello there again.
And they asked how much is it and how long does it take?
How long did the procedure take?
Yeah.
I mean, this will probably take us maybe 15 minutes or so. And the price can range. I mean, usually it's between, $1,200 to $1,500, depending on the area that we're doing. And this can last, though, actually a year or more. The way I do it,
Nice goggles.
Thank you. The way I do it, I like to create little lines, and what's nice about this is that the body can build collagen around this, because you can even find this might last a year, 2 years, or more. We've had lips, right, Sally, that have lasted 3-4 years.
Mine have lasted quite a while.
Right, so the way that I do it, I take a lot of care on what I'm doing, and it's really helpful. So she's numb. So even though it's going to look kind of strange, yes, I have a needle here, and this is something called Juvederm, Juvederm Ultra.
Oh, they want to see my lips. Okay, turn around.
Do I turn it around?
I just tap it twice. This is Sally. Say hi, Sally.
Hi. I love my lips. Don't like my glasses. Love my lips.
Back to our regularly scheduled program. So
we're flexible like that.
Okay, so the first thing I do is we have to make sure we're cleaning things. So we have an alcohol swab. You might smell this more than you feel it. And you are nice.
Great lips. They like my lips.
Yeah. Thanks, guys. I actually teach this, and I had Sally was a model of mine because I was teaching a course recently, because I teach other doctors how to do this and Botox. And I'm in Tampa, we were in a local hotel, and she was my model that night. So I treated her in front of a whole bunch of doctors, and they learned, and I taught them my tricks. And anyway, now you're going to get to see me do this live here.
How long do they stay swollen?
The swelling, why don't you ask that, Sally? What do you say?
I have 3 days.
About 3 days, okay.
It goes down after the first day.
Yeah. Okay, so
and your average cost, is there an average cost?
I said honestly, $1,200 to $1,500 usually, and it can last a year or two or more actually for that, because I really know what I'm doing. You can find it cheaper out there, but you're with someone qualified here, so I'm not the cheapest, but I'm really good at what I do.
Do you need a volunteer?
Sometimes I do, actually, depending on the town. Sometimes I'm teaching courses, I can use volunteers. So, okay, so we're going to start here, and we're going to start just outside the lip border here. Prime our little needle here. You let me know if you feel any discomfort here. You ready? You okay there?
It says, what is the benefit of Botox? What you get, what you
pay for. And how long have you been doing this?
Oh, I've got
a lot of questions.
I've been doing this for 16 years now.
Yeah.
So already you see I'm creating a little tiny border for her. She has pretty young lips. We're just trying to make her better.
Sally, you are graduating from
And for me, because I call it ergonomics because I've already started on this side. I do the half of the lip first. I do the upper and lower lip first, and this is the first part. And you're okay comfort-wise? Mm-hmm. So isn't that amazing, guys? Let's pull back. What anesthesia does, proper anesthesia like we did yesterday with the Kybella, what we're doing today, is that it's comfortable. She's not having a lot of pain, and that's so...
She said this makes me feel nervous.
I know. Well, that's because I know what I'm doing.
Awesome.
Okay, so the next part is... Yeah, if you guys have questions, you're welcome to type them in. And also, if you can, like the channel. Follow us. Because we'll be able to show things. Actually, later today, if the patient agrees, we're going to show you how we use a laser to actually help treat a mole, right? We're going to do, if the patient agrees. We don't know if they agree yet, but if you tune in later today, we're going to do a laser to remove a mole that's very difficult to remove. So I think guys will find that fun. It's amazing we don't have a lot of oozing here at all yet, right?
I've got somebody here that really wants these lips. Oh yes, show that please, show the resurfacing, and she wants the lips.
Well, you can contact our office, and we take care of people all over the globe coming to see me for things that I do. And then here's her little cute angle.
I love that part.
Right? And so we don't have to use a lot, but already you already see a nice outline to it. Isn't that pretty?
Beautiful.
Beautiful outline. Now I'm going to create something called the Cupid's bow. I'm going to rotate you a little bit this way.
I have somebody that will volunteer when you're in West Palm.
Okay. Well, we might be giving a talk in Miami in October in South Miami at a restaurant there. They're asking us to come down there and give a talk, so they can come to our talk.
She said that's nice. You're nice and quick.
So we're fine-tuning here. So I'm just looking. I have to just judge the angles here. So this and this, okay. Okay, another assistant is taking over here. This is Maria. She's taken over, and Maria can habla español.
Para los que hablan español y tienen preguntas en español, yo las puedo responder. Has anyone ever wanted like a lot put in that at one time, as in 2 syringes?
I try and do, it's really about ratios. I have a book on Amazon that you can download called The True Definition of Beauty. So if you go to Amazon, put in The True Definition of Beauty, you can find my book. I talk about ratios. I want things to look great, but natural. And so that's what I'm always concentrating on. I don't want things to look unnatural when I'm doing it. I mean, she's pretty already. That looks pretty, doesn't it? With her little border.
Yeah, I love.
Okay, now we're actually going to give her a little bit of volume now that we've outlined her.
Jessica, how do you feel?
You can talk for a second.
I don't feel anything. It just is nothing.
Feels great.
Yeah,
That is the wonders of proper anesthesia.
And somebody said natural is best.
That's what we want. Because she's beautiful. We want to make her a better version of herself.
Believe me, this anesthesia is so much better, Jess.
I know, with anesthesia.
You would feel it.
Mm-hmm.
So if the person wants to look crazy, would you accommodate them?
We're in Tampa. We have a lot of strip clubs in Tampa, and that's my concern. Is that I would rather not have them look like the people that down the strip clubs in Tampa. I want them to look natural. So I'll work to make things as good as possible. But I'd rather it be a natural beauty. Isn't that good?
It's perfect.
She's laughing.
Because actually, if they look equal, then you look like a female entertainer in one of the clubs in town. And that's not what I'm looking for. Nothing against them, but that's not what I'm looking to create for my patients. It's already coming out. Look at that.
Mm-hmm.
So if someone didn't like it, would there be any way to reverse it, or is it like this for good?
Yeah, actually, this is hyaluronic acid. So this can be dissolved with something called hyaluronidase. And yes, these are totally erasable if they don't like it, but we've never had that happen. No.
Never.
Wow. That looks nice. You like how we've done already with her upper lip? Is people liking that?
She said, did you take a before picture?
Yes, we
And
do.
they say,
Yes,
"Great."
and when we get done, we can try and show you before and after. Yes. I'm gonna give
How
her-
long will any swelling last?
That question came before. We said about
2 to 3 days.
2 to 3 days is most of it. I mean, there can be a little bit longer swelling there too. But most of it's in the first 2 days, 3 days.
It says looks good, and another person asked, do you get people who want the Kylie Jenner or Angelina Jolie look?
Yes, we do get, yes, and I can help with that to a certain degree, yes. That's nice. When you were smiling, the upper lip was disappearing. Now it's starting to,
Show.
It's starting to show more.
Mm-hmm.
I'm going to do a little bit on the lower lip, and then we'll go on. I might go back and touch up the upper lip again.
Yeah.
So,
You like it, so?
I do, but you need more, yeah.
so let's do a little bit here, and then we'll... Now, the important things about lip augmentation, this is mechanics, and this is really more for professionals, but you really want it fuller in the middle, and then you want it to taper on the sides.
Well, what a difference already.
Well, thank you guys.
Which treatment is this? What is he using?
This is something we call a Volumilift. And if you go on my site, you can look that up. I mean, I'm treating the lips on her only, but a lot of times I'll treat lips, this area here, the jawline. I can treat lots of areas.
Is this the same way you would do the forehead and the wrinkles?
No.
Botox actually works better for the forehead and the wrinkles, but that's a great question. Because, yeah, people get confused. They think that Botox works on the lower face.
So many people.
And I will tell you, it is possible. I do Botox sometimes for lip line, kissing lines, that people get sometimes. I do Botox here and here. You know, sometimes when people pucker, they'll have little lines there. And I have done Botox for that. I've done some Botox down here. It's much safer to do it in the upper face, though, the Botox. Okay, so let's keep going now with our...
What's the average cost for Botox?
Botox can start at around $300, and it can go up from there. I mean, we can do some that are $1,200. It really depends on how much people are doing. But, you know, an early treatment can be, a simple treatment can be like $300.
Somebody just spelled V-E-L-L-U-M, lift.
Voluma?
Voluma.
I think they made another one.
Yeah, Voluma.
V-E-L-M-A is what she meant, Velma.
Oh, Velma.
lift?
I don't know what Velma is.
I don't know what it is.
Do you know what that is, Dr. Scheiner?
Look at that projection, huh? That's nice.
Yeah, she didn't have no upper lip. Are you only located in Tampa?
I am. This is where I live. This is where my family is. But honestly, where do we have people come from?
Everywhere.
The world. They travel oceans to see us. So, and we have, the nice thing, we're actually very close to the airport, and we have people who come in just for the day. They can fly in, fly out the same day for a lot of treatments.
We have patients that come in for fillers for the day.
Right? Are we getting just nice comments? No haters out there, right? Okay, good.
Come to Louisville, Kentucky.
Oh. Well, you know, you come here if you come here in the fall or the winter time from Louisville. We have beautiful weather here, right? And Disney's really close to us.
Lots of hearts.
Oh, thank you for the hearts, guys. I'd say, yeah, isn't this Jess donating her face for you guys? Is that awesome? Let's get some hearts for Jess, okay?
They are giving a
Is
lot
that
of
awesome?
hearts.
I mean, for
here
a
they
young
come.
person to put this up there, isn't this amazing? She's
Awesome,
amazing.
Awesome job there, dog.
Thank you.
She needs more on the top.
A lot of hearts
Is this
too.
a doctor?
There's a lot of hearts going on. But yeah, that she needs more on the top, they said.
Yeah, wow. But I'm liking the way this is coming across right now.
A lot of hearts too. Whoa. I'm pretty sure he knows what he's doing.
People.
Kill me.
So later today, guys, if you tune in, when is our laser mold treatment? The laser.
Patient's 4 o'clock, probably 4:15.
Yeah, 4:15. If he agrees, if our patient agrees, you might get to see a laser treatment for how we can take moles off the face, which is really cool.
Thanks for showing this.
You're welcome, guys. I mean, I thought that this is interesting. I thought people might.
This is our fun stuff.
This is the fun stuff that we do.
I love it.
I thought it might be cool for you guys. Okay, I think it looks good. Yeah.
Now I want even more.
Come on in, make an appointment.
Here we go. Projection.
Getting there.
You hear the music in the background, guys? Christy McCool.
Is she numbed?
Yeah, she's very numbed. Yeah.
Probably different layer of people coming.
I can drive 3 hours for beauty.
Do that. We'll be here.
And that was fast, easy stuff. And a lot of hearts, too many hearts.
Too many hearts.
Never too many.
a lot of hearts.
Look at them all. Look, it's like bubbles.
Oh, that lot, too
guys,
many hearts.
You guys are awesome. Thank you. And hearts for Jess, right? Hearts for
Hearts
her.
for Jess,
I mean, because
absolutely.
she's awesome.
A lot of hearts.
Is she brave to show this to you guys? I think it is. I think she is.
Look at all those hearts.
It's so cute.
Do you massage the lips after?
Yeah, you're going to see me do it actually in a little bit here.
Wow, look at all the hearts are not stopping this whole time.
Oh, you guys are awesome.
Oh, they asked if you massage the lips.
We will, yeah, we will.
Oh, he said, oh, okay. We didn't hear.
Let me just do this a little bit more here.
Somebody said so cool. Somebody said, ouch. Jessie, are you in pain? Not at all.
Guys, when I do my things, I'm all about comfort and anesthesia, and so she's been numbed ahead of time, and this is easy, right? You can have a conversation. You just listen to music, listen to us talk, and it's not painful, right? Let me do a little cross here.
And the same person just asked, is it numb?
Yes, it is numb.
Looks beautiful, Dr. Scheiner.
It's because I have a beautiful canvas to work on.
Aww. Very professional. It's painful for me.
And if you're watching it, you're thinking like, oh my gosh, how is she tolerating this? But the reality is that she's been numbed, so I'll tell you what, that...
Will her lips diminish some after the swelling?
Yeah, they will swell a bit and then they'll come back down, but this is close to where we are. I'm going to take a look here for a minute.
And how long does the injection last?
So this should last usually about a year initially. So if someone's asking about mold, I kind of sculpt the border first because I like the light line that we're creating for her. And then the massage kind of. So let me do this. We have our cotton ball here.
A lot of hearts now that you're. It looks like you're done. Looks very good. Very impressed.
We'll just take a look because we have to clean her up first, and then you'll get to really see.
Next time we should do that before and after.
Well, when I take her picture, I'll show you the after here in a moment. Open for me. So this is just something to clean off the, because we do get a little bit of oozing of blood here. Open, baby. Close.
Fabulous.
Do they look beautiful or what?
Gorgeous.
Beautiful, guys? Hearts for beautiful lips?
Gorgeous. Gorgeous.
So let me take a picture and then I can show you guys the picture on the camera, okay?
A lot of hearts. She looks great.
Okay.
You're gonna love Jess.
Well, does anyone know how long that was? Did you guys time it?
15 minutes. So good.
Okay. Okay, let's take the picture first, and don't smile.
Okay.
We want you natural. Look at her cute sneakers, though. Oh, let's get some hearts for her cute sneakers with the bows on it.
They just say you're going to love your lips.
She hasn't seen it yet, guys. What do you think? She gonna like it?
Yeah, they said like 15 minutes. They said yes. Yeah. So we got. Yeah, I really like it.
Okay, so this is the after. Can you see the after?
I like it so.
And that's the before.
Wow.
That's the before. You ready, guys? And that's the after.
Nice.
Before. So the problem was her lower lip. We want balance. It's about ratios.
Do you like the way she looked? I'm sorry. Before.
Oh, I think
You
she.
like the way I love it. I love
Her upper lip was too small for her lip. It didn't balance. It's about ratios. If you read my book, guys, you'll see it. But that balance is better. That ratio of, I brought both out, but 1/3 to 2/3, that's the ratio we were trying to achieve here. So it's all about ratios. So you enjoy seeing that, guys? Okay, if you want, we're gonna go here in a moment. But today around 4 o'clock, if you tune back in, we might, around 4:15 maybe, we might be able to show you a laser treatment for facial moles. And guys, thanks so much for following. Please follow the channel, follow this. We're also on Twitter, Facebook. You can follow us there. And thanks so much for watching,
I
guys.
said thank you. They need this. Thank you. They need this.
Do you guys have any other questions before we go?
Let me see. I have to wait. Yeah, they look great. She looks awesome.
Let me show you the mirror. Hold on.
Thanks to you and your patient.
It's so cool.
Is that cool?
They're numb. But
I know,
it's
is
so
that cool?
Yeah.
Do you like her reaction, guys?
She's so happy.
Yeah, they look great. Okay, then no question. But a lot of hearts.
Let them keep going. That's okay. Let the hearts go. Is that good? What,
That's good.
is she? Hold on. Is my dear patient
There
not
you
the
go.
best for allowing us to show this off?
Yes. They say
Okay.
yes.
And actually, let's show you one more time. So for people who didn't get to see, this was her before, and that's the after.
No, turn on the light, Sally. What makes it? It shows it more. There you go. Look.
Oh yeah.
Before, after, and that's her after.
And that's her. There she is. Awesome.
Okay, well, thanks, guys. Very well. Let her go. Give
With
them
a
hearts like-
bunch of hearts.
That's right. Well, we.
Okay.
We have to go.
We're good to go. You know what? Tune back in. Maybe around 4:15, we might be able to show you this laser treatment. But guys, thanks so much for watching. Once again, like our Periscope channel, like our Twitter, our Facebook, and all that. And thanks, guys.